Schistosomiasis, also known as bilharzia, is a disease that affects millions worldwide. This parasitic infection is a major public health concern, particularly in developing countries where access to clean water and adequate sanitation is limited. The disease is often overlooked, but its impact on communities can be devastating. It is caused by a parasitic worm called schistosoma. These worms have a complex life cycle that involves both human and snail hosts. The larvae of the worm are released into fresh water by infected snails, where they can penetrate the skin of people who come into contact with the contaminated water. Once inside the human body, the larvae mature into adult worms and reside in the blood vessels, where they can cause significant damage to internal organs. This worm thrives in certain types of freshwater snails. These snails are commonly found in slow-moving or stagnant water bodies such as ponds, lakes, and irrigation ditches. The presence of these snails in water sources used by local communities is a key factor in the spread of schistosomiasis.
While schistosomiasis is not usually fatal in its early stages, it can lead to serious health complications if left untreated. Chronic infection can result in severe damage to the liver, intestines, lungs, and bladder. In children, it can cause growth retardation and cognitive impairment, affecting their ability to learn and thrive. Understanding this disease, how it spreads, and how to prevent it is crucial for public health, especially in areas where access to clean water is limited. Public health initiatives, such as educational campaigns and snail control programs, play a vital role in reducing the incidence of schistosomiasis.
This disease is particularly prevalent in tropical and subtropical regions. These areas provide the ideal environmental conditions for the freshwater snails that host the schistosoma larvae. The warm climate and abundant water sources create a perfect breeding ground for these snails. These regions often lack access to safe drinking water and sanitation. People in these communities frequently rely on natural water sources for their daily needs, which increases their risk of coming into contact with contaminated water. Improving access to clean water and sanitation is essential in the fight against schistosomiasis. The impact of schistosomiasis is often silent, but its effects are far-reaching. The disease can cause chronic illness, leading to decreased productivity and increased healthcare costs. It places a heavy burden on affected individuals and their families, as well as on the healthcare systems of endemic countries, affecting individuals, families, and entire communities. Addressing schistosomiasis requires a comprehensive approach that includes medical treatment, public health education, and improvements in water and sanitation infrastructure. By working together, we can reduce the burden of this silent threat and improve the health and well-being of affected communities.